All right, well, we're not talking about that. We're talking about a fair that's coming up that's going to help you become heart healthy.
Yeah, this is important.
Very important. Sarah's here from the Intermountain Medical Center Heart Institute. Thank you so much for coming in.
Thanks for having me.
I was just talking about how I so much enjoyed the event last year.
Oh, good,
Yeah,
good.
it's for the whole family.
It is for the whole family. There's activities for kids, screenings, seminars, so there's something for everyone.
Okay, so what's the intent of this?
Well, so much of heart disease is preventative, yet we have so many patients who are so sick, and it's still the #1 killer in our nation. But there's a lot you can do if you can change what you eat, if you know your risk factors, like how high your blood pressure is, for example, and then if you can get more active, it can really save you a lot of trouble.
So we're at this Heart Healthy Heart Fair. Are you going to help people determine whether or not they have these risk factors?
Exactly.
So how does that happen?
Well, the first thing you're going to do is you're going to go through a screening, and I brought what we use for that screening. We call it the My Heart Health Passport, and we ask you a lot of questions about your lifestyle and your family history. We take some measurements, your blood pressure, your body fat, your weight, and then that determines, how you're doing, if you seem to be at risk. And if you do get a score that means you're at risk for heart disease, then you can go on and get an EKG that day, which will be read by a provider who can help you understand if anything actually is going on with your heart.
Okay, and you got an EKG last year, didn't
Yes, I did. And I talked to one of the fabulous cardiologists that you had there. And it's such a nice resource for people that maybe don't have the means to get this.
Exactly.
And to get information where to go for further information, because I came back with an abnormal EKG and I went for further testing. And
oh, good.
It was a really great starting point, and I learned I needed to change my lifestyle.
That's great. I'm so happy to hear that. That's such a great story.
How long does the EKG take, and what are we talking about here? How many people typically will have a problem?
So we, let's see, I'm trying to think through our numbers last year. If we screened about 1,000 people, I think about half of those went on to get an EKG, and the other half didn't seem to have any issues, so they didn't go on. And then when you go into the EKG, you can get a ticket for a time slot, and then the EKG takes about 15 minutes, then you wait another 10 or so to meet with a physician who can read that with you.
But
really
you can
well
get that all
organized.
done in one day while you're there.
Yeah.
Okay.
Well, these are important things to remember because, sometimes when you're a little bit younger, it's the last thing you think about is your ticker.
Yeah.
But
sure.
there are heart attacks 1 every 34 seconds in the United States.
Exactly.
And if you don't have your heart, you don't have a lot going on.
That's true. I know.
So these are so important. So we're looking at some of these statistics right here. The leading cause of death for people of most racial ethnic groups. So does that mean that some people are more predisposed than others?
Right. So there are, among whites, heart disease is a bigger killer than, say, cancer. But in some other racial groups, like in Asians, for example, cancer is actually just a little bit above heart disease.
Oh, that's an unbelievable statistic that heart disease does kill more people than all cancers combined.
It really does.
How big of a problem it is.
Again, and so much is preventable. So much is preventable. If you see your doctor and change your lifestyle, you can live a long, healthy life.
#1 thing you can do.
#1 thing you can do is a heart-healthy diet.
Okay.
What
So
you
diet is very important.
Diet.
Okay.
You need those healthy fats, lean proteins, lots of fruits and vegetables.
Okay, and you'll learn all that there.
Absolutely.
Well,
And you get so many, sorry to interrupt, so many freebies. I mean, it was so fun walking around from booth to booth. We were walking out with shopping bags full of stuff. It was weird. My kids thought it was Christmas once again.
Oh, good.
Really nice things.
Now I want to go.
You're in. You're in.
Dan wants a swag bag.
So the Heart Fair is February 4th from 9 to 1. Is that right?
That's right.
Okay, and you can accommodate everybody in those hours. It's at the Intermountain Heart Institute at Intermountain Health Center in Murray, and there's the address. It's 5121 South Cottonwood Street there in Murray.
And did you say it's free?
It is free.
It's free. I
And
love free.
you don't need to register either. So
Just show up.
just show up. Yeah.
Sarah
We
Young,
hope to see you
thanks
there.
so much. Yeah.
Thank you.
Nice to see you on our side of the
Yeah.
studio. Usually you're over there cooking.
know.
with
Heart
me.
healthy meals.
Exactly. Exactly.
It all
Yes,
comes
all good
together.
things.